Hi, I'm back. So today I wanted to talk to you about high blood sugars. A lot of you know that I was diagnosed with gestational diabetes when I had my first son. And so I went to see an endocrinologist, and he told me to use one of these, a glucometer, and I had to prick my finger 3 times a day and send him the numbers. I was just writing down numbers on the piece of paper. I had no idea what I meant. But he wanted me to also see a nutritionist to try and control my diabetes with nutrition. And of course, she told me to eat high carb, low fat, artificial sweeteners, avoid fat by any means possible. And so I followed her advice. And a month later, I was told that I actually also needed insulin to help control my gestational diabetes. Both the endocrinologist and the nutritionist told me that if I wanted to avoid diabetes in the future, which is a common diagnosis after having gestational diabetes, that I would need to continue my low-fat, high-carb diet and continue the artificial sweeteners. And after about 6 months post-pregnancy, I determined that wasn't really working for me. So I started doing my own research, and I found out that fasting blood sugars below 100 are considered normal. If you are in the range of 100 to 125, you're considered pre-diabetic. And 126 or over on 2 separate occasions, you are considered to be diabetic. So 6 months in, I started testing my fasting blood sugar, and I was already 130 to 140 on a pretty consistent basis, which, as I just explained, is considered diabetes. So I never had the diabetic label put on me by a doctor, but I was definitely headed in that direction. Like I said, the high carb thing, it just wasn't working for me. It didn't feel right, and my weight was not moving. So I started doing my own research, and most doctors and most health professionals are going to tell their patients that they need to control this with their diet. Like I said, the high carb, the low fat, and they're going to tell you need to manage it that way. And when that doesn't work anymore, then they put you on medications or they put you on insulin. And they pretty much lead the patients to believe that's the only way to control it. You just got to keep working at that diet, cut those calories, cut the fat, and that's how you're going to get healthier. Meanwhile, a lot of patients just get sicker. I didn't want to take that route, so I started lowering my meals to 25 carbs or less per meal. I started intermittent fasting 12 to 14 hours a day starting out. I'd probably do it like 5 to 6 days a week starting out. And then I also started walking, which at the time I lived in Indiana and the weather does not always cooperate, but I walked as much as I could, maybe 2 to 4 times a week. And in just 3 to 4 months, I took that consistent average of 130 to 140 to below 100. I went from diabetic levels to normal levels in only a few months. So that's what the power of diet can do. Now, I can't sit here and tell you that this will work for you. I'm not a doctor. Don't take anything I say as doctor advice because I'm not. If for some reason you're working with your doctor and you're not healing, there are low-carb doctors out there. Maybe try them. Anything I tell you is just educational and my experience. So with that being said, I wanted to go ahead and test my blood sugar to show you because it's been 3 years since I had the gestational diabetes diagnosis. I lost a combined 145 pounds by eating a high-fat, low-carb diet. And so my sugars, like I said, are no longer in the 130 to 140 range. Here's me, I'm pricking my finger. And for anyone doing this for fun, which for health, for fun, whatever you want to call it, a good tip is to prick on the side of your finger. There's a lot less pain than if you prick right there. That hurts. I figured that one out fast. So I pulled this back. I'm going to prick my finger. And then you got to squeeze. You see the blood coming out. And I'm going to test. So there it is. It's testing. 80. So I went from 130 to 140 following the high carb diet. Now I am at the normal level of 80. So while we are here, I'm also going to test my ketones. And the reason I want to do this is I get a lot of emails from people insisting that they are in ketosis. And when I ask them what they're doing, they tell me that they are testing their urine. I don't mean to be the bearer of bad news, but you're probably dehydrated. You probably need to drink more water and take more salts, because when those pieces turn purple, they don't really tell you if you're in ketosis. So let's test my ketones. Same thing. Takes a little bit longer. 2, 1, 2.1. Pretty good ketones for 9:15 in the morning. So once again, I'm not here to tell you that you should be eating a low-carb, high-fat diet to change your blood sugars. I'm here to tell you that that's what worked for me, and it's always worth looking into it if you think it could work for you. All right, thanks for following me at Eating Fat is the New Skinny.